Hi viewers, this is Dr. Iftikhar Aslam from Pakistan. Today I'm going to present my lecture on contagious bovine pleuropneumonia. It is a contagious respiratory disease of cattle, water buffalo, bison and yak. In this lecture, we'll cover the information regarding the organism that causes the contagious bovine pleuropneumonia. We'll also talk about the economic impact of this disease in the past and could have in the future. Additionally, we'll talk about how it is transmitted, the clinical signs it has, and the diagnosis and treatment of this disease. Finally, we'll cover the information regarding the prevention and control measures and the actions to take if contagious bovine pleuropneumonia is suspected. Mycoplasma mycoides subspecies mycoides small colony type bacteria is the causative agent of the contagious bovine pleuropneumonia. Mycoplasma mycoides subspecies mycoides small colony type survives well only in vivo and is quickly inactivated when exposed to normal external environmental conditions. The organism does not survive in meat or meat products, nor does it survive outside the animal for more than a few days in nature. Contagious bovine pleuropneumonia spreads rapidly and can cross the international border. In countries which still have a high incidence of CBPP, such as Zambia, Tanzania, and Botswana, the social and economic impact of the disease is substantial. With the difficult economic situations, these countries already face vaccination programs for CBPP have been reduced. Depending on the country, the farmers may not be compensated for their lost livestock, which threatens not only their livelihood but also their social well-being, like in Zambia, and even their survival, as in Botswana. Morbidity and mortality rates vary greatly for CBPP. Breed susceptibility, general health, and management systems all influence the severity of the infection. Mortality ranges from 30 to 80% in Africa and can be affected by the secondary factors in overall health, such as nutrition and parasitism. In Europe, recent outbreaks resulted in only mild disease and mortality rates were very low. Of recovered animals, as many as 25% may become the carriers of CBPP. The introduction of a carrier animal to a susceptible herd is the most common cause of the outbreaks. Close contact is necessary for transmission, which occurs primarily through the inhalation of infected droplets from a coughing animal. The organism is also present in saliva, urine, fetal membranes, and uterine discharges. Transplacental infection has been known to occur. Humans are not susceptible to CBPP infection. Cattle, both Taurus and both Indicus, are the main hosts for the Mycoplasma mycoides small colony type. The infections have also been reported in Asian buffalo, captive bison, and yak. Wildlife does not appear to be important in the epidemiology of CBPP. Humans are not susceptible for the CBPP infection. The incubation period is highly variable and can be up as long as 21 to 180 days, depending primarily on the susceptibility of the animal. In adult animals, lethargy, anorexia, fever up to 107 Fahrenheit, and a drop in milk production are the first signs of CBPP. These are followed by a cough which becomes moist if the animal is forced to move quickly. The animal may also exhibit a change in posture, with the front legs placed in far apart, the elbows turned out, and the neck stretched forward. These signs progress to include thoracic pain, dyspnea, and increased respiratory rate, moaning during the expiration, and reluctance to move. A common clinical finding in an animal infected with CBPP is the neck outstretched when the animal is coughing. When the animal is standing, the usual posture is with the neck forward, the legs placed far apart, and the elbows turned out. Animals with chronic infections have less obvious signs of pneumonia but may cough with exercise. These animals are often thin, may have recurrent mild fever, and can appear to recover after several weeks. Infected cows commonly have polyarthritis with or without pneumonia. Joints may be warm, swollen, and extremely painful. Subclinical cases occur and may be important as carriers. Animals chronically infected with CBPP are often very thin and depressed, as shown in the picture. Before collecting or sending any samples from the animals with a suspected foreign animal disease, the proper authorities should be contacted. Samples should only be sent under the secure conditions and to authorized laboratories to prevent the spread of the disease. Since there can be many causes of severe pneumonia in cattle, the contagious bovine pleuropneumonia is difficult to diagnose based on the clinical signs alone. Animals with CBPP frequently present with unilateral pneumonia and in a herd with signs of pneumonia in adults and polyarthritis in calves. The CBPP should be considered. Postmortem lesions are often helpful in diagnosis. Mycoplasma mycoids subspecies mycoids can be directly identified by culture, immunological tests, and polymerase chain reactions or PCR. Serological tests include complement fixation used only for herds, not for the individual diagnosis, useful for the subclinical cases. Competitive ELISA and immunoblot. A latex agglutination test has also been developed. Treatment is recommended only in endemic areas because the elimination of the organisms may not be possible and the carriers may develop. Antibiotic treatment is generally not effective as it can result in extensive tissue damage and sequestration of the organism. Although the tylosin has been reported to be moderately effective. As soon as the outbreak is suspected, the slaughter and necropsy of the suspect animal is advised. Quarantine of the exposed and infected animals is recommended along with the restricted movement, testing, and slaughter of the infected animals. Although the Mycoplasma mycoides subspecies mycoides may survive in the environment for a few days and survives well with the freezing, it will not survive in the meat or meat products and is inactivated by the common disinfectants such as sodium hypochlorite can be used at a 3% solution and is prepared by adding 3 gallons bleach to the 2 gallons of water. Immunization with attenuated vaccines like T144 strain is helpful in disease eradication. In areas where the cattle cannot be confined, the spread of the infection can be curbed by the vaccination. However, many of the countries in which the CBPP is a serious problem have desperate economic situations, and vaccinations may not be possible in those countries. Well, with this, we are going to end our today's lecture. Thank you.